So another case here, and let's just look at the progress of this case treated by Dr. Dennis Allman. Now, this patient also presented in the dental office, and the chief concern here was sleep apnea and snoring. And we can see that these teeth, if you count the teeth, we can see that there was a tooth missing here and a tooth missing here. This is a patient who had orthodontic treatment when she was a teenager, and in this case, the teeth have moved back to their kind of positions, but also the teeth that were extracted, the premolar teeth that were extracted here, that space has been lost. So she starts wearing the appliance for a few months, and we start to see a little bit of change. There's no space here, a little bit of space beginning to reappear in these regions here. And then she's wearing the appliance now for a few more months. You remember, the little space here is starting to increase, it's starting to get bigger. See it on both sides. And then after about a few more months again, that space is increasing again. So this is where she originally started, and this is how much space has been captured after about 18 months or so. So what is it telling us? What it's telling us is that the body has that template. That template is encoded by genes. And so in this example here, the jaw was small, the teeth were taken out, but if we talk to those genes saying, can you get the jawbone to regrow here, that's what's happened. And so we've got more space here to try to accommodate the teeth that were taken out, and eventually we'll get these teeth straightened out as well. You can see they're starting to move into the right position. It takes time. So this is an adult patient, approximately mid-40s, that kind of age. And so what we're able to show here is it's still possible to regrow bone in these adult patients, and that will allow the teeth to be accommodated without having to take these teeth out. And here's the same patient here. You see she had a very deep bite when she started her treatment, and for about 14 months' time, the bite is starting to open up, the upper jaw is getting nice and wide, and the lower jaw will eventually catch up. So there's some way to go still, but she's showing remarkable improvements for middle-aged adults. And look at her facial features. The face kind of looks a little bit sunken in here. These grooves look a bit deep. The lips look sunken in. And she looks younger here than she does here, in my opinion. And she's a happier and healthier patient. You see her jawline is starting to improve here. We start the jaw profile starting to emerge. The lips are becoming fuller. And look at her smile. Can you see these big spaces here? She's got a broad smile, and she's a happier, healthier patient getting towards the end of her treatment than she was at the very beginning.